Hooyah! This is Robin from the Back Pain Secret Podcast, and today we're going to talk about surgery and sciatica leg pain. So, if you're feeling that pain, your back bugs down your leg down to your foot, and you've gone through weeks of physiotherapist, you visited the chiropractor, you've been everywhere, right? And you've put in the work in the gym, and you're doing the core stability exercises, and for some reason you're still feeling this burning, tingling sensation down your back, buttocks, down your leg, down to your foot, okay? And you don't really know what to do now. You've been talking to all kinds of different professions, and some are saying that you should operate your back, and some say that you shouldn't operate your back. And you're confused because all of these people that you're talking to are basically very well educated, right? So first off, to start off, that's what we're going to cover in today's episode. But first off, uh, just a quick breakthrough, right? So if you're suffering from sciatica right now, chances are that you have problems in the lower part of your back, right? You could have like the disc thickness could have reduced a bit. That's one reason. The disc could also be pushed to the left or the right. That's one reason. Bulging disc, slip disc, or you could have a herniated disc. That's like 90% of people that are suffering from sciatica leg pain, they have a herniated disc. It means that the disc has popped open. You will have a bit of fluid that has run out and it's pressing on the nerve and nerve root, and the nerve gets inflamed, and you're feeling this tingling, burning, electrical feeling down your leg, basically. Okay, so going through that, there's many different procedures that you could go through when you have sciatica. So the first one is definitely to try the conservative method to like visit a physiotherapist, get some core stability exercises, stand up more at work, walk every day, don't be twisting and turning too much, all that stuff, okay? So these are like the signs that I'm going to talk about now that you definitely need to consider to have surgery, okay? So first off, if you have bowel and bladder dysfunction, okay, meaning when you have this, you will actually have more compression down here, okay, on the spinal cord, and that's like next level shit, okay? You need to take care of that because that can turn into something really serious quickly. So please make sure if you have bowel and bladder control, you might need an operation, okay? Also, if you have something called spinal stenosis, and that's also that you get more compression down here. And the tell sign for that is when you're out walking, okay? Usually, let's say that you're out walking usually for half an hour, but you're feeling like week by week or month by month that you're not able to walk a half an hour in one go, okay? You walk and then you basically need to stop and bend over a bit or sit down even to reduce the compression on the nerve roots, and then you continue to walk, okay? Especially this starts when you're like over 45, 50 usually, okay? Also, if you're experiencing like neurological dysfunction, meaning you have problem lifting your leg, you even might we have something called drop foot, when you're actually trying to lift your foot, but you're not able to lift the foot because the nerves that control the foot down here, they're actually compressed, so they're sending less signals down. That's also one thing. And then also, if you've had this sciatica pain for for a long period of time, maybe months or even years, and you've gone through all these traditional treatments and nothing is really helping you, then you should definitely consider surgery, okay? But then again, I even have quite a few back surgeons that come to get treatment for, they want exercises and want the physio stuff before they get operations. And a lot of back pain surgeons actually have back problems because they're bent over all day, okay? And they're always working, right? So I could just see from them when they're coming in here, they're in really bad shape, and they want to try everything possible before they have an operation. So you shouldn't do an operation too quickly. Okay, you need to go through this normal phase. Don't stress it, okay? But definitely, if you've been suffering for 3 to 6 months and you've tried all the stuff, then you should look into maybe surgery, okay? Or at least have a chat with your spine surgeon about it, okay? So what different options are there then when you're doing these operations on the back, okay? It's so first off, you don't want to get we don't want to get too technical here, okay? Because there's so many different procedures, and it depends on like who you are, where you have your blockage, okay? But you will say like this, that usually in the majority of cases the, they more or less what they do, they try to like reduce take away as little as possible, so they won't go in if you have like milder blockage here. They won't go in and take away the entire disc, okay? They might go in and just do like micro dissectomy. It's more or less like they're just like more or less vacuuming away the bit of the disc that is pressing on the nerve root, okay? And hopefully when they do that, that's actually going to free the nerve, and you're going to get less pain from that, okay? But there's other procedures as well. Sometimes, you know, they go in and they actually like take away the entire disc if you're in really bad shape, or they could even like put in a mobile disc. There's so many different techniques there, but usually, like I said, 90% of the people that are suffering from sciatica, it's because they have a herniated disc. And you that are watching this, you can see this little red thing, that's a herniated disc. The disc is actually cracked open, popped open. You'll have a bit of fluid that runs out. It looks like toothpaste. And what they do then, the surgeons, they go in, they try to like just take away that little red stuff, okay? So the nerve gets less pressure on it. Very, very effective. So that's like the thing. Then there's other stuff as well, you know, but I'm not going to get in too much into that. Then you have like the sciatica recovery, okay? And it's important to understand as well, you know, especially if you've been suffering from sciatica for quite a while, right? You definitely need to understand that even if you have had the surgery, you're not going to like feel good straight away. It's really, really important to understand that. Usually you could do, but don't like have that expectation going in to the surgery that you're going to be okay. Like just after the surgery, you're going to stand up and walk home, okay? It's going to take a few days, maybe a few weeks, okay? And really doesn't really matter what kind of surgery you do. You need to take it easy in the beginning. You know, you need to keep the incision area clean. Beware of like lifting heavy objects, obviously, okay? Bending over or sitting too long. You could think of it almost like this, like that you have a band-aid on there. You had a cut and you put a band-aid over it, and now you need to take it easy for a bit, just to make sure that the area heals, okay? But in like sciatica surgery is in general very safe, okay? But like there's always certain risks, like nerve damage. You could have a blood clots, infections, all of that. You know, anytime that you have an operation, there is risks, but in general, it's considered very, very safe, okay? Always, or usually after surgery, you will also have some kind of pain medication, okay? And most likely you will visit a physiotherapist as well, just to guide you with some like lighter core stability exercises, and more or less get you going, give you a kick, right? So you don't get lazy, because it's important to that you're moving and you're doing stuff every day after the surgery, but you can't do too much or too little. You need to find that like that that mid ground, right? That works for you. Very, very important, okay? So will the spinal surgery relieve your sciatica pain? Absolutely, it can definitely reduce the pain, but it's important to understand that if you've been suffering from back pain or any pain for longer than 3 to 6 months, it's more like a chronic pain. It's going to take a while for it to reduce. A lot of times when you have surgery, people have too high expectations of that, and they think like, I'll have the surgery now and everything's going to be a-okay, and no, I won't have any more problems in my life. If you've had pain, this burning, tingling sensation, you're in your back buttock that you lay down to your foot. You've had it for 3 to 6 months or even longer, and you've gone to the physiotherapist. You've had acupuncture. You've had TENS. You've had core stability exercises. You are standing up more at work. You are walking every day the amount you can. Okay, you're not twisting and turning. You might have had an MRI, and it shows that you have like a slip disc, bulging disc, or a herniated disc, and you had a chat with the spinal surgeon, and they say, you know, well, they recommend you to have surgery. If you feel still anxious about the surgery, you could always have a second opinion. You know, you could have a chat with another spinal surgeon. So if both those spinal surgeons think that you would benefit from the operation, okay, and your pain is really really horrible. I mean, the painkillers aren't helping. You might have a drop foot. You have problems with bowel movement. Definitely. Um, but in the end, the is really up to you. No one can force you to have this surgery, and it's a big decision. Anytime like you have an operation, it is a big decision. And I understand if you're looking at this right now and you're nervous and you don't really know what to do. This could like give you some guidelines, but definitely you need to have a chat with your spinal surgeon and make sure to write down all the questions that you have regarding your surgery before you go into that visit, okay? Because the better you are prepared when you have a chat with them, the more at ease you're going to be afterwards, okay? Because it's really all about the information. And I wouldn't really recommend you to go online and read all about it, because it's too much information there. Every person that have an ability or are recommended to have surgery, their like situation is different. Okay, their age is different, where the blockage is different, the motivation level is different. So there's many different factors that the spinal surgeon will um, like include in the decision if you should get an operation or not. Okay, I really hope that helps. Guys and gals, if you enjoy this episode, send it to a person that you know is suffering from sciatica. Okay, take a screenshot, put up on social, and tag me, Back Pain Secrets TV, if you want to help me to spread the word. If you have any questions regarding your sciatica pain, put them down in the chat box there. I'll be more than willing to help you. Take care. I'll talk to you guys and gals tomorrow. And don't forget, you're just one step away from reducing or even fixing your sciatica pain. Bye bye.